Hello, this is the American Medical Association's Moving Medicine video and podcast. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Today, we're bringing you a special end-of-the-year feature. It's going to be our last episode of 2021. We're going to see you again with a new episode on January 3rd, 2022. It's been an honor and a privilege to bring you physician and expert voices throughout the year on both our Moving Medicine and COVID update channels. As we look back on 2021, it's difficult to put into words what all of our physicians have experienced in this past year. They've dealt with continued uncertainties about the pandemic, the distribution of life-saving vaccines, only to be followed by rampant misinformation. Equity issues in medicine and society, social and physical isolation, burnout, and that was just the beginning. For this episode, we asked physicians to answer 3 questions to help capture 2021. We thought it was best to let physicians tell their own story in their words. Here's what they had to say. The first question that we asked physicians was, what was your key piece of learning or advice that you give from the past year?
Our health is the most important thing that we have.
Stay true to your why.
We have to get more comfortable with the fact that we have to change our minds sometimes or admit that perhaps we were mistaken and be okay with that.
Maintain wellness.
Take a deep breath.
Flexibility. All of us have had to learn a lot of flexibility this last year and now.
Be transparent.
Offering grace for those who we're working with and grace for ourselves.
Be patient.
Effective communication is the solution or part of the solution for every human problem. And this pandemic year has only reinforced that belief.
The future is not certain.
Science is important in medicine.
We have an amazing public health workforce in this country and a healthcare workforce, and I'm so grateful for their dedication, their support, and their commitment over the last 20 months of this pandemic.
Prior preparation with emergency preparedness.
The one piece of advice I have is get vaccinated.
Respect this virus. I think many of us think that we're invulnerable. They think this virus is just going to bounce right off of us or bounce off of our children. It's not true. I mean, I'd like to think enough of us now have been touched by the horror of this particular virus that we would be sobered by it, but unfortunately, that's not true for many people.
Transparency and communication.
We have demonstrated last year that being together, we were able to expedite the deployment of vaccines much faster than we ever have seen in the history of medicine.
The second question was, if you could sum up this past year in 1 or 2 words, what would they be?
Challenging, rewarding.
Everything is terrible? Is that too dark?
Whirlwind and growth.
Indoors and Zoom.
Gratitude. I have never been prouder as I watch my colleagues around the country run towards the fire and take care of patients under difficult circumstances.
Come together.
Perseverance.
Unpredictable.
Resilient and grateful.
Crazy.
There is hope for the future.
Just gratitude.
Resilience. Focusing on not only providing care, but also on our employees to help them through these surges that we've had.
Seclusion and inclusion.
Devastating.
Incredibly challenging.
Hope and disappointment. Hope because as we enter the year, we know that we have a vaccine that put the pandemic behind us. Disappointment that we unfortunately turned a healthcare issue into a political debate.
The final question we asked was, where do you see the biggest opportunities in 2022?
We have to continue to do everything we can to get those who are unvaccinated, to get them vaccinated. This is extremely important for us to be able to put this pandemic behind us.
Reconnection, new connections, coming together as a community.
To recognize that the massive investment in public health is not only necessary, but has been necessary, and we need to make sure we fix that in the future.
Learning and gaining confidence.
I think the biggest opportunities are in adapting to the virtual environment in the residency selection and frankly in the residency education process.
We got a lot of opportunities for disruptive innovation.
Learning how to be normal again.
To help support making sure that folks are getting to the point of understanding clearly the root causes of the inequities, but also getting to the point of advocacy and accountability.
Self-care. Patients are going to be much more engaged in their care. They're going to be much more focused on using apps and digital tools and empowering themselves with information because they're going to make their health a bigger priority.
2022 marks the 175th year since AMA's founding in 1847. Therefore, this anniversary year provides a great opportunity for the AMA and the medical profession to reflect on its past, the good and the bad, because understanding our history is essential if we are to build a healthy future for all.
Telemedicine.
Research and education.
Improving access to care, whether it's virtual care or hospital at home, we have to find ways to get care out to where our communities are.
I think the biggest opportunity is to impress upon people how amazing vaccines are. A virus that was isolated and sequenced in January of last year, in 11 months, we had 2 large clinical trials using a novel technology that showed this vaccine was remarkably safe and effective. I don't think there is a scientist on this planet that would have ever imagined that was true. I think it is the greatest medical achievement in my lifetime.
Getting people vaccinated and getting some semblance of normalcy with our workforce. All the other healthcare problems have not gone away. I'm very hopeful that we can find ways to get people back into healthcare to continue the work that we're doing, taking care of everything else in addition to COVID.
There are so many things for us in healthcare to achieve. There are disparities that have been highlighted more than we have ever seen before.
Giving all my friends who I haven't seen in 2 years a great big hug.
That concludes our special end of the year feature. From all of us at the AMA, have a safe and healthy holiday. Take care, and we'll be back with you in 2022.